for peripheral vascular disease. Essentially, it involves disease of the arteries of the body. As we grow older and concomitant with developing heart disease, we can develop vascular disease. And PAD can have different presentations. You might have a mild pain in your legs when you walk, to the most extreme cases, which what we call critical limb-threatening ischemia or critical limb ischemia, which are essentially wounds that are not healing, and that's due to poor blood flow. And a staggering number of patients undergo amputation as a result of non-healing wounds, which we know that amputation has a mortality equivalent to many cancer and perhaps worse than a lot of cancers that people fear. So that's very important to recognize disease early and seek treatment early to avoid the most dire complication, which is amputation. About 20 to 30% of my practice involves patients with peripheral vascular disease of different severity, and about 30 to 40% of that includes the most extreme spectrum of the disease, which is critical limb ischemia. It's very prevalent in our community. Unfortunately, it's often under-recognized and under-treated, and we see patients late in their course while they have been suffering for quite some time. Well, these treatment options would have been available much earlier if they sought treatment earlier and were referred earlier to a vascular specialist. Lifestyle modification is very important. In fact, American Heart Association recommends that we routinely screen certain population for PAD, not that necessarily we're going to offer an invasive treatment approach to them, but to modify the risk factors to prevent the progression of their disease. And those risk factor modification involves healthy lifestyle choices. So smoking cessation is on the top of the list, weight loss, cholesterol control, good dietary habits that would ultimately lead to less cardiovascular disease. These are important measures to take and prevent this from happening or slow down the progression. We also often refer our patients to physical therapy sessions before offering invasive treatment. And physical therapy also has a very important role if you have the disease before an intervention. But lifestyle modification choices are very important to prevent and slow the progression of the disease. So, treatment of peripheral vascular disease, especially more advanced stages of the disease, really requires a multidisciplinary approach. And one of the good things about being part of a smaller community hospital is that we have a very close collaboration with our colleagues in podiatry, wound care center, vascular specialists, and that unique relationship and having the care available locally is very important to ultimately have the best outcome. So, I'm very proud to be part of the team that our wound care center has such a outstanding amputation-free rates of 84% in 2020. That's a very good statistics. And a lot of it has to do with building that local expertise network to offer everything locally, including advanced technologies in endovascular therapies, as well as hyperbaric chambers in wound care, and that cohesive approach is very important to ultimately yield the best outcome.